I'm Dave Kindig from the University of Wisconsin Population Health Institute, and I'm really honored to be here to moderate this session. And hasn't it been a great day already? I know this is even going to be better, but yeah, I just can't, I am so impressed with the energy, enthusiasm. I guess I'll say the average age in the room. I think it's all quite hopeful for the future. So just a couple of introductory comments before we get to our panel. In 1974, Victor Fuchs, who is still a distinguished emeritus professor of health economics at Stanford, in his book, Who Shall Live, said this: "How much then should go for medical care, and how much for other programs affecting health, such as pollution control, fluoridation of the water, accident prevention, and the like? There is no simple answer, partly because the question has rarely been explicitly asked." In 1996, I gave a presidential address for the Association for Health Services Research, which is the forerunner of Academy Health. And actually, I showed that slide, and then I said this: now that we are in it, so this is 1974, 1996. Now that we are in a time when attention is turning to fundamental health outcomes, when performance and value purchasing are becoming discussed by business coalitions, when there is a serious discussion of a new connection between medicine and public health, we find that our research community has not invested nearly enough in the knowledge and understanding we need to guide policy. So certainly progress has been made since that time, a lot of progress. Social epidemiology did not exist, certainly in 1974, and even in 1996, the beginnings were just beginning to be appreciated. We now have new dimensions of big data and analytic technology, some of which you just heard about in one of the breakout rooms, and that we've never dreamed of back then. And as evidence in this room, a new generation of young scholars, many who are here, are assuming leadership positions in scholarship and in our institutions, both academic and in policy. So that's all very hopeful, and we've come away. However, I still think that we don't fund, don't ask and answer the critical pop health questions often enough and at a scale necessary to guide public and private policy, given the challenges that we see today. I also co-chair our IOM Roundtable on Population Health Improvement. We're proud to help sponsor this meeting here today. We've focused on 6 fundamental drivers of population health improvement. They are metrics, resources, policy, public and private, relationships, communication, and evidence. While all these are important and obviously interrelated, I am increasingly convinced that the lack of policy-relevant evidence is a major barrier and possibly the Achilles heel of our emerging and nascent population health movement. So this is our opportunity, and why I'm so pleased and bullish about this new association that is kicking off here today, whose vision not only includes cutting-edge interdisciplinary science, the best science, but also in their vision statement, communication platforms and knowledge exchange to increase overall population health and reduce the continuing unacceptable health disparities in the country. Those are worthy challenges and visions of this association. So I think today is a great beginning, and I would like to challenge all of us to join together and make the next 10 years a coming-of-age decade of population health policy relevant research, so that we will not have to read again in 2025 the 1974 Victor Fuchs quote that I began with. So to help us think about and plan for the most important questions of the population health decade to come. We have a terrific panel to help us build the pop health research agenda for the field and for this new association. So the full bios of our three speakers are in your conference materials. I will only read their basic information. They will each speak for 20 minutes, and then we'll have hopefully plenty of time for questions. So in order, we'll have Alonzo Plow, who is Vice President for Research, Evaluation, Learning, and the Chief Science Officer at the Robert Wood Johnson Foundation. Anna Diaz-Rue, who's Distinguished University Professor of Epidemiology and Dean, the Drexel University School of Public Health. And then Bill Kessler, who is in the Preventive and Population Health Models Group of Center for Medicaid and Medicare Innovation and Chief Medical Officer in New England for CMS. So we will have them come up in order, and then we'll have time at the end for questions, and we start with Alonzo Plow.